today. Do want to do a quick reminder that we do ask that you please mute your phones and your computers. A lot of times folks, if they forget to mute their computers, will get some feedback. So please make sure both of those are muted. We are very excited about today's webinar. We're going to be talking with Dr. Sarah Vanover with the Division of Childcare with some updates on the reopening of childcare. So again, welcome to this month's CECC monthly webinar. We will be talking with Dr. Sarah Vanover. We also are very excited for the introduction of our new Executive Director, Amy Neal, who will be speaking with us in just a few minutes. Hopefully we'll have a little bit of time. There is a lot of material that we'll be going over today, so hopefully we'll have a little bit of time for questions for Dr. Vanover at the end. And then at the very end, hopefully we'll be able to go through some quick reminders as we get closer to the end of this state fiscal year and moving into the next grant cycle. And then talk a little bit about what we're going to be looking for in next month's webinar. As always, we always want to start, I believe that this is the third webinar that we've hosted while we've been working from home. So we're coming up on 3 months of working through the COVID-19 crisis. And I always try to repeat this as we are kind of getting close and to opening back up and doing all of this, is that we will get through this and we will get through this together. I think that those are really great words and a great reminder that the state of Kentucky is really doing a great job at tackling this crisis, and that we are doing this together. So with that, I would like to introduce Amy Neal. She is the former Vice President of Early Care and Education with the Metro United Way, the former Director of Success by Six with the United Way of Greater Cincinnati, and she's also a certified educator who has trained advocates across the country. I've known Amy for several years, and we are so excited to have her. She's going to be a great advocate for our work. So with that, Amy, would you like to address our folks?
Hi, good morning. Can everybody hear me?
Yes, ma'am.
Okay, thank you, Amanda. So I just wanted to take just a couple minutes just to say hello and really to say congratulations, everyone, on securing your annual grants for your community early childhood councils. I've been a part of many of those, and I know that that's a lot of hard work, so nicely done. Just wanted to take a minute to just remind everyone what the mission is for the Governor's Office of Early Childhood, and that is to provide leadership and direction for the Commonwealth by providing a comprehensive and sustainable prenatal to age 5 early childhood system to ensure that every child has a strong start. You all know better than anyone else that community early childhood councils, they were established a long time ago with the Kids Now legislation 20 years ago, and it's all about promoting school readiness. And as we look across the Commonwealth, really, it's so many of our communities, you all are the boots on the ground, and you know what strategies are working. And you know what strategies we need to grow to ensure that more children enter kindergarten prepared. And so really just wanted to say thank you for what you do. We appreciate your partnership. And just to reinforce the role here of our office about providing leadership and direction and support, I feel very honored to be in this role, and I'm looking forward to connecting with some of my former peers and friends across the state, and then meeting new ones. So I'm happy to turn it over to Dr. Vanover, who has a pretty full slide deck. Thank you, Amanda.
Thank you, Amy. And as I said, we're so excited to have you on board and really look forward to really growing a lot of the work that we do. So with that, I will turn it over to Dr. Vanover. one of the reasons that we asked Dr. Vanover to join us today is because you guys really know your communities better than anybody else. And so we're hoping that through the information that we provide you today, you guys can help educate some of the folks in your community on what is going to be done for the reopening. So as always, as we're going through, please put your questions in the chat. We will try to get to those as we get closer. There is a lot of information. So Dr. Vanover.
Well, thank you all so much for letting me talk to you today. Of course, many of you know that this past Thursday, Secretary Freelander and the governor announced the plan to reopen Kentucky's childcare programs. And they hit the highlights in the press conference, but there's a lot of content. If you go to the Healthy at Work website, you can click on the plan to reopen, and there's just a lot of information. So today I want to share with you some of the information that may help you answer questions in your community. I will let you know that later today we'll be emailing out a frequently asked questions sheet to all of our childcare providers, and I can send that to Amanda to send out to the CECCs also, so that you can see the most common questions that we are already receiving. But if you want to move ahead, Amanda. So the two big dates that everybody needs to know is that June 8th, all family childcare homes can reopen. And on June 15th, all center-based childcare can open. Now, that does not mean that they are forced to, but those are the dates when they are allowed to. Because we're already hitting summer, many of our programs that operate on the school year would not be reopening until August. And some centers may be in a financial position that they want to delay that just a little bit, but these are the dates when they are allowed to reopen. You want to go ahead? So there's a few things that, due to current regulation and policy, we're already going to lay down. We are assuming that all programs are reopening on their set dates, and because we technically didn't close centers. The Division of Regulated Childcare paused centers and told them that children could not attend, but nobody actually had a closure put in place. So if a center decides that they do not want to readmit children and reopen in a normal structure, then that's when they need to notify Division of Regulated Childcare that there are changes there. And it's going to be really essential that all centers get onto their rosters, both in the CARES background check database and in ECE TRIS, to let us know employees that have separated, and make sure that all employees are entered, because of course those two databases are used for all licensing surveyors when they go out to do visits, to know who's currently employed. I want to move ahead. So the big changes that people need to be aware of, and let me start off by saying this. Nobody likes change. And no matter what changes were implemented, we were going to have some people that were very upset. These have been hard changes for me and many of us to look at and figure out what's best. We're having to balance between CDC guidelines and what the Department of Public Health thinks is safest for children, and with the financial stability of our child care programs, just to do the best for all families and for our programs. So this is where we're starting right now. These are not permanent, but for right now, this is what we're going to do in order to keep our children healthy and safe as they re-enter group care. All programs must utilize a maximum group size of 10 children. And that means 10 children plus the adults that are caring for them. But 10 children will be in a group. Now, for 2-year-olds and up, 10 children may be watched by one adult. But for under the age of 24 months, if the full 10 children are present, then they will have to have 2 adults in order to meet those child to staff ratios. And so those ratios are still in place. Now, the other thing that we want to think about with these 10 children is that they need to remain only in that group size all day long, because the more we condense classrooms down and combine them, then the more exposures that they are. So those 10 children will stay together from start to finish all day, and we will not be combining additional classrooms together during early or late hours of the day. Go ahead. We are going to limit the amount of adults and people that can come into the program. So this is going to mean that, the local librarian won't be able to visit. Tippy Toes dance programs or the tumble bus will be limited because we want to really reduce those numbers of exposure. So those who are allowed to be in childcare programs as they reopen include facility staff, persons with the legal authority to be there. So emergency responders, DCBS if they're doing an investigation, Division of Regulated Child Care, and other cabinet agencies like Childcare Aware and Childcare Health Consultants may be there for support. Necessary utility workers, if there's an air conditioning issue or plumbing, those people are allowed to come in. Professionals providing medical or therapeutic services to children with special needs. If you have a nurse that comes to give an insulin shot to a child, then they still will be able to be there on site. Next slide. Children enrolled in the facility, of course, and parents or legal guardians of those children. Now, please note that it does not say siblings of those children. So parents or guardians will have to figure out how to pick up these children first, because introducing additional children into the program will have a lot of exposures at this point. And then if we're talking about family child care homes, of course, the family members who live in the home of the approved child care provider and have been background checked, they will also be available to enter the program at this time. Move ahead. So other than that, no visitors or student observers will be allowed at this time. So that includes tours. It includes any CDA or practicum students that are not currently employed at the center. However, programs may use virtual observations or virtual tours. If they're doing a tour while children are there virtually, they've got their phone or a tablet and they're showing parents what's going on, then there must be permission of the parents for someone to view. But we don't want to have those exposures after hours either. So I've had directors ask me, well, I do my tours after the children are gone. Can I still do that? If those adults are coming into the facility, it's still creating that exposure, even if it's after hours. So we really want to go back to a virtual method right now during this particular pandemic situation. And then as requirements ease up, we'll be able to change that eventually. And then there will be no family-wide, center-wide events at this time because we're trying to keep those groups of 10 children isolated with as few exposures as possible. Move on. The biggest question that we have had since Thursday night is, can we use temporary walls to divide classroom space? So the answer is yes, but there are going to be requirements on that. So we are speaking about walls. I'm not speaking about hanging shower curtains or anything like that to divide space, because we are wanting to make sure that children stay within these groups and that these are structurally sound. So the requirements that will go along with this for temporary walls means that the walls must be 6 feet tall at a minimum. It could be an accordion wall that pulls out, or it could be a structure that is added at this time. It cannot be rearranged furniture. So we're not going to put shelves just in the middle of the room, mostly because that's very unstable. Children could pull them down, or lower shelves like the children would use in the classroom. They can easily reach over or climb over that. So we want to make sure that the children's safety is essential during this time period. So it must be something that is structurally stable. A few more requirements on the next slide. If you divide a classroom up, it must still have the square foot requirement for each group of 10 on either side of the wall. Or if you're going to do 8 and 8, it still has to have 35 square feet per child as it's divided. Divided classrooms will be able to share a bathroom. That we know even during normal that not every classroom has a bathroom. However, if we have multiple classrooms of children utilizing a bathroom, then there needs to be an increased amount of cleaning in place just because of the number of children that will be using that facility. And then the other requirement, we are trying to eliminate traffic patterns during this time period where children would be passing by each other in the hallway in close proximity. So the traffic pattern of the divided classrooms would have to allow for children to enter and exit the classrooms without increasing the health risk. So if you put up a divided wall and one classroom has to go through the other classroom and interact with those children in order to exit, then that's not the traffic pattern flow that we want to see in order to isolate those groups of 10. You can move. We are looking at different ways to social distance. Now, I want to stress to you that social distancing in a child care program is different than social distancing for adults. And the CDC is aware of that. At no point in their recommendations do they say that every child must stay 6 feet apart from each other at all times. If you have ever worked in a classroom full of 15, 18-month-old toddlers, you know that there is no way to keep them 6 feet apart. And we're being realistic about that. I'm being realistic about that because I've been that teacher in those classrooms, and you can't tell a small child that they can't hug you. So there's other ways that we're going to reduce that to create social distancing. And one is making sure that playground time is staggered between classrooms. If you have 4 or 5 classrooms that share a playground, then we need to alternate those classrooms as opposed to having all groups of children on there at once. Also, during this time, we will have no field trips and there will be no group transportation. Many of you know that, in school buses or 15 passenger vans, when we put kids in there, and in school buses, we put preschoolers in 3 to a seat, and 15 passenger vans, they're buckled in tight. And so that just really allows no space between them. So we're going to suspend transportation at this point in time. And I'll elaborate that a little more in a later slide. If you want to go ahead. We are going to ask that parents or guardians have a centralized drop-off location. For example, instead of allowing every family member to take the child to the classroom, enter, talk to the staff and the children in there, and then exit, during this time only, we're going to have a centralized drop-off where a parent or guardian would drop the child off at one location. A staff member would help escort them to the classroom. That way, we are limiting the amount of outside germs. We're going to ask centers to discontinue the use of group water fountains and of lost and found bins, just areas where there would be germs collected in one location so that we can keep children as healthy and safe as possible. I want to move on. Cleaning and sanitizing has always been a part of our childcare programs, and we are going to stress that that is just essential during this time period. But we also want to up our game a little bit. So one of the things that we're asking all care providers to do is to create an individualized program for their center. We know that all centers are different. Some have carpet, some have hardwood, some are in the basement of church buildings with a business that's running above them. There's just so many circumstances. And so to create that enhanced cleaning plan, we need to see that each program is looking at their specialized circumstances and the CDC guidelines, and that they can create that plan and post it in the facility. Childcare aware staff and childcare health consultants will be available to consult with the centers and help them with this plan. And the plan must be created prior to reopening of the center. And so we want to talk in there about those enhanced things like, how are we cleaning all the doorknobs on a regular basis? How are we cleaning ventilation? If there are vents throughout the building, are we checking those instead of just waiting until right before an annual licensing visit? Are we making sure that the airflow is coming through clean vents? Those types of situations. And so that plan, it doesn't have a specific template. It can be however the center would like to set it up, but it does need to be created and posted in an area where anybody who's in the facility can review that. Go ahead, please. We're going to ask that soft toys, machine washable toys, will not be used at this time. So soft baby dolls, soft cloth blocks that might be in an infant or toddler room need to be put away for this time because of the challenges of cleaning those. Toys that are out, we really want to reinforce and just have child care providers up their game. If something goes in a child's mouth, then it needs to be immediately removed and put in a container for items that need to be cleaned. Bedding for nap time. Of course, we always ask that it stay separated, but if it's in cubbies or locations, it cannot hang out and touch whatsoever. And it must be cleaned at the end of the week. I am a parent who has been guilty of leaving bedding at the school, because I'm a working parent who is often scatterbrained when I have picked my children up from childcare, and I admit to that. But childcare programs are really going to have to work with families. If you're taking a child to a centralized drop-off location or a pickup location to be picked up, then you need to have that bedding ready to go and hand over to the parent and get it washed and cleaned every week. And just make sure that those cleaning procedures are in place and reinforced. Go ahead. At this time, we're going to suspend family style dining. Although this is an excellent procedure that we usually want to have in classrooms, it does make sure that, when a child is scooping out their peas, they may not be as clean and sanitary as we always want them to be. So plates at this time need to be prepped by the teachers and placed individually in front of the children. Again, we're suspending transportation. What we're going to do right now is during these summer months, we're going to just suspend transportation totally. When public school systems look at reopening, we are going to look at what policies they put in place for the public school system buses, and then we're going to try and mirror those in the child care programs. But at this point, as we're just opening and just trying to get these healthy and safe procedures and centers, there will be no group transportation for any of the programs. And with no field trips, that's a lot of the transportation, but for programs that go and pick up children, this will be a time where parents will need to drop them off at the center location. I want to move ahead. Okay, so hand washing has always been a part of the procedure. We know if you have ever been a child care provider that in winter you wash your hands so much that they are raw. And we're going to keep those in place, but there is one addition. Along with washing hands at arrival, teachers and children will now be asked to wash their hands right before leaving, because we are making sure that any germs, whether they're healthy germs or not healthy germs, whatever it is, that they stay in the isolated location. So arrival, returning from outside, toileting and diapering before and after meals, after contact with bodily fluids, all those things we're doing just like we usually do. But then right before the child leaves or the adult leaves, we're going to wash hands again before transitioning into a new environment. Move ahead there. Clean and sanitize. There's so many times I've been in a child care program where they forget the dual combination. We want to remove dirt and we want to remove germs. So we need cleaning and sanitizing. And we need to do that frequently, more so throughout the day, especially on frequently touched surfaces. One question we've had a lot of, and I see it on social media when I'm on Facebook or Instagram. I see all these ads about these UV light wands or cell phone cleaners with UV light. We do not have enough research that is that it's effective, that it's killing the germs that we need for it to kill. So right now, cleaning and sanitizing will remain that bleach water process, and UV ray cleaners will not substitute for that process. Go ahead. So business practices, a lot of the Healthy at Work general business practices were included on the child care Healthy at Work plan. Now, some of those are a little bit, they're a little different for us than they are for typical businesses. For example, on the Healthy at Work plan, and it's included in our regulations, that it says to limit the use of restrooms whenever possible. Well, we are not doing that for children. We will not limit the use of restrooms for young children, but outside visitors, we can ask them to refrain from using the restroom if at all possible at the facility and wait until they have a different location. Some of the business practices that we do want to recommend, but not mandate, just because of resources, is using digital communication whenever possible to avoid passing papers back and forth from hand to hand. If there's a way to do digital daily sheets or things like that, communication with parents, parent letters through a listserv for the center, that's encouraged. But we understand that not all child care programs have that resource. So it's not a mandate, just an encouragement. If you are an office worker at the child care program, director, assistant director, billing manager, we just ask that you use the same phone, the same computer, the same desk supplies instead of sharing those among staff members in order to reduce the spread of any germs. And again, use digital billing whenever possible. But we also understand that some programs do not have access to that. And so we're not mandating it, but it is encouraged. If you want to move ahead. Screening for illness. This is going to be a big one. And I really stress that we want to eliminate anybody who is ill from coming into the center, because once they're in, they automatically have more contacts. So we're going to use that centralized drop-off location. So when the child is dropped off, that's when we want to do that visual screen check. Look at the child, look for their coloring. Is their coloring off? Do they have watery eyes, runny nose? Do they look flushed? And also temperature checks must be conducted before anyone enters the building, and that is for adults too. If you are a plumber or utility worker entering the building, then you need to have your temperature checked as well. I went out a few weeks ago to get signatures for our emergency centers for the hero bonus, and as soon as I walked in the door, those centers put the thermometer up to me and checked my temperature, and that is going to be what it is expected for adults as well as children. So we want to make sure that that's checked. Fever is being set at 100.4 by the CDC right now. Centers have the ability to adjust that. If they want to make it a 100, that's their prerogative. But on our end, anything from 100.4 and above is considered a contagious fever. And staff members who demonstrate symptoms of COVID-19 must be tested for the illness. It is not mandated for everyone in the facility to have a COVID-19 test before reopening. And if they don't have symptoms of COVID-19, we're not forcing anybody to have a test. Only if they show those symptoms, if they show fever, if they show difficulty breathing, if they show the symptoms that have been indicated to be part of COVID-19, then they need to be tested for COVID-19. Next slide. Other things that we want to think about. We've always asked that a child who is sick to be isolated from the group, but sometimes that child has remained in the classroom and just put in a corner further away from the other children. We're changing that protocol a little bit. If the child shows contagious symptoms, they must be removed from the classroom immediately. The parent or guardian must be contacted immediately, and they have 1 hour from the time of contact to pick the child up and remove them. And that's going to be a policy change for many centers. So centers need to let families know about that policy change in advance. A big question that we have had is how long the center has to be closed or how long the person has to remain away from the center if they are diagnosed. There is no CDC recommendation on that other than contacting the local health department. The health department has different ranges of how many days they must be away based on the last time they showed symptoms, the last time they were at the facility. It could be 3 days, 10 days, 14 days. A center might not have to be closed based on when the child was last there or how many cases. So all of that is up to the local health department, and centers need to partner with them, reach out to the county health department and get that information. When a diagnosed case is in the center, so there is a child or an adult who has tested positive, the center must notify all the families and staff that a case has been diagnosed in the center, but they must keep the privacy of the individual as well. So just put those notifications up that a case has been diagnosed and make sure that no names or no identifying information is included in that. Next slide. PPE, these are some big questions too that we've had. All adults must wear face masks at all time in the facility, unless there is medical harm to that individual if they do it, if they have significant asthma. And, we're not asking staff members to come back if they're in that high risk group, but if you have a parent coming in that has a significant health risk and a mask could really harm their ability to be at their best health, then we understand that there could be an exemption there. But staff that are working in the facility, utility workers, parents, medical workers that come in, they do need to wear a mask. Now, here's where we're having a lot of questions. Children age 5 and under should not wear a mask in the facility due to risk of suffocation and strangulation. The CDC specifically says that children 2 and under are at risk of suffocation for wearing a mask. But our preschool children from 2 through 5, they still have a lot of risks due to strangulation if they're wearing a mask and a child pulls it or it gets snagged on a bookshelf when they walk by, those types of things. It is a risk to the child. It's the same reason why there aren't strings on hoodies for young children, because we don't want that to get caught and strangle them. If a parent comes in and asks or demands that their child wear a mask in this age group, it's just not a good idea. And the center needs to let the parent know that, if that's a demand that they want, then maybe they're not comfortable yet putting their child back in group care. A mask for a child this age is not preventing that child from getting ill. It's preventing other people from getting the germs of that child. So it's not really a preventative measure for that individual child if the parent demands it. And in the group care with 10 children in the room, there's just so many ways that it can be pulled or injure the child. Now, school-age children, we want to encourage them to wear masks where able, but it has a lot to do with the temperament and the developmental ability of the child. If the child can't stop touching it, they take it on and off and on and off. It's on the floor one minute, on a table another, then it's not doing any benefit to the child because it's been exposed to many germs on the floor, different places. So keep that in mind. I have a 7-year-old with a developmental delay, and there is no way a mask is going to stay on all day. But we have older children that may be able to wear them all day. So just that point is based on the ability of the child. Move ahead. We went too far. Can we go back to gloves? As far as PPE, gloves are going to be made mandatory at this time. They have always been encouraged for diaper changes, feedings, those kinds of things, but it will be mandatory for food handling gloves, latex, non-latex gloves to be used. Masks need to be available. And childcare wear will be checking before centers reopen that they have these supplies on site. It can be done through a virtual visit. The center may just FaceTime them or Zoom them and show them those supplies. But they have to be seen that they are available. I will tell you that childcare programs have had more success finding PPE supplies through food vendors right now, like Gordon's Foods, US Foods, or through office supply stores. The medical supplies chains have been more likely to tell childcare providers they don't have access to these, and they're saving them for medical supplies, hospitals. But the food vendors and the office supply vendors have been able to access them. I know a lot of childcare providers are concerned about the mouths of the teachers being covered, either that children are scared or that for language development, it could hinder that. As a childcare professional, I feel that and I understand it. That's why this is not a permanent change. There is a company called clearmask.com that you can order masks from that have like a clear plastic over the mouth so the children can still see how your mouth is articulating and they might be less afraid. But in general, right now, the mouth covering is essential to prevent the spread of germs to our young children. I want to move ahead. There's a few training and safety things that are changing. All staff members are going to be required to take a mandatory training just to refresh themselves on cleaning, sanitizing, and being a mandatory reporter for childcare programs. We've had 9 or 10 weeks now where children have been out of public school and childcare, and child abuse reporting has gone down quite a bit. Families have been at home and under a great deal of stress financially. Spending a lot of time together, and families who are already at risk, this can be very challenging. And so once they re-enter childcare, we may see that some children have been in at-risk environments, and we want to remind childcare providers that it's essential for them to report that that's their obligation, and we want to remind them of that process. Also, this training will be free. It will be up and available on the UK HDI website as of June 1st. Our in-home providers need to take it first. It's not going to be a long training at all. But before June 8th, all of our in-home providers need to take it. And before June 15th, all of our center-based providers need to take it. If you want to flip ahead. The Division of Regulated Childcare will begin routine inspections about a week after each program opens. So in-home family childcare environments reopen on June 8th. So about a week after that, they'll begin to inspect those environments. And then the same June 15th is when center-based care reopens. And a week after that, they'll be doing those inspections. During all this time that we were closed, there were a lot of things that childcare providers were unable to do, and many people were unable to complete their training hours if the center couldn't pay for them or if they didn't get paid for that time. So training hours are going to restart on July 1st, 2020, and people will have a full year till June 30th to complete those hours. And that time period is going to stay the same. There is a regulation that's getting ready to pass in June that's going to make everybody have the same start date for training hours every year so that directors will not have to keep track of many different hire dates. This was already in the works, but it'll be a great transition right now since many people may have lapsed on their training hours during the time of the closures. I want to move ahead. So changes to background checks. This is a big one, and I want to make sure everybody understands this. All child care providers that already have a completed and approved background check in the care system are ready to return to the classroom and be left alone with children. New childcare providers. So the state fingerprint background check system is not up and running again yet. And it'll take a little while because that's a very face-to-face, hands-on environment. Those are at DCBS offices and career centers. And so those will be opening over the next several months. And there's going to be a high demand for new childcare providers, for foster parents, for lots of different people to be fingerprinted. So in the meantime, we're going to go back to the name-based background check system that we used to utilize prior to the fingerprint system. So that'll be a CAN check, a Kentucky State Police check, and if the person worked out of the, or not worked, lived out of the state of Kentucky in the past 5 years, they'd have to have a background check from that state as well. As soon as those are mailed off and submitted, the person can be a probationary member of the child care staff, but they cannot be left alone with children until those background checks come back and they are approved. Once the paper name-based background checks are approved, then the individual can work alone with children. But when the fingerprint system reopens and there is availability for people to get in and get it, they will need to eventually get that fingerprint piece. But for the time being, we have a federal waiver in place that is going to allow us to do this for a short amount of time so that new employees can begin working as we try and get those national fingerprint background checks up and running again. And I think that is all of our content. There is an FAQ sheet that's going to go out today, and all of our child care providers will get it. I'll make sure that the CECCs get that information. But also, if you have questions now, I'm happy to address those as well.
Thank you so much, Sarah, for all that great information. I have been seeing some folks chatting over here in the box. A lot of folks are asking if they can get access to this PowerPoint after we get finished today. And I think that we can release this, correct, Sarah?
Well, here's the only thing. This doesn't include everything. You know, it doesn't have every tiny little rule. This is the highlights. So if you view this and you look at it, you have to remember that it is not every detail and that you shouldn't rely solely on the PowerPoint. And we're not posting it on our website or on our social media because we do not want providers to think that this includes everything and to not go to the Healthy at Work site. We are filing emergency regulations this week, and this content from the Healthy at Work Reopen Plan will go into emergency regs, and it will have other details than are represented in this PowerPoint. So please keep that in mind, that this does not cover every detail.
That is really, really good to know. We are currently recording this, and generally we do post it on our YouTube and send it out just to the CECCs.
Okay.
So if you need to run that up to your leadership to make sure that's okay, if you could just let me know.
I will follow up with that.
Okay. One clarification, gloves at all times or just during the feeding and diapering?
Gloves during feeding and diapering and, handling fluids, first aid types of situations. And again, just making sure, if you're using gloves to do bottle feedings, change every time. Gloves are not beneficial if you wear the same pair of gloves all day. It's the same as not having gloves on because you're exposing yourself to many different germs.
Here's another question from Leisha Barlow. What about wraparound childcare programs? The group changes during the day based on when they are in the preschool classroom and when they are in childcare. Guidance for that.
So we are putting an FAQ question in there about like AM, PM services. If there's an AM class, then there has to be significant cleaning before the PM class comes in. And that needs to be in the plan. Now, combining classrooms, if you have an all-day program, and typically they add like an hour in the morning or an hour in the afternoon for parents that need to drop off early or later, those groups of 10 cannot be combined. The same children have to be together all day, and only those 10 children. But if you have separate kids for AM and PM, and there'll be a group of 10 here and a different group of 10 here that stay together, then that will just be a cleaning plan in the middle.
That makes sense.
And I will tell you that some centers have reached out to us and they are reducing their hours of operation during this time period because of that. Like maybe if they open at 6, they're going to open at 7 for a while. And if they close at 6, they're going to close at 5 instead because they're worried about those hours that they normally combine. I mean, this is going to be a time where people have to think a little bit out of the box in order to meet these regulations.
Okay, another question here from Shanta Small. When will the emergency regs be released?
They'll be filed this week, so they will be processed really quickly. Emergency regs stay in place for 9 months. I've already, my team has written the language and we're getting that together. And it just is a matter of getting it posted and in place. We will send the link out to childcare providers through the listserv when those are up. But they're all based on the reopen plan that is on the Healthy at Work website. The difference is that the regulations will be the things that are mandated, whereas there are some recommendations online that would not be mandatory.
Okay, were there any other questions that folks had in the childcare reopening? I'm sure that as you guys are talking within the community, you might have some more specific questions. So if you do, just go ahead and shoot those over to me. Oh, we got another one. Can you clarify maximum group size? Does that include teachers and students?
10 children with the addition of the adults. So the adults are not counted in the 10 group size. It is 10 children in maximum groups. And let me say this. I know that all these changes are hard. I've been a teacher. I've been a director. And, I've spent the past 2.5 months laying in bed at night trying to figure out how to support our childcare programs. And I knew that, our public health and our CDC was going to have recommendations, and we tried to find a balance between what they wanted and what directors needed to stay open. The temporary walls can help a lot of programs, and so we're hoping that some of these balancing measures will be in place. Please know that we're doing everything to fight for you, that we're trying to help. This is not recommendations that we're taking lightly. And, the CARES Act funds are there to support, and we are trying to do that as much as possible. We understand that staff are going to have to take breaks during the day. We understand that staff will be off. We just need you to limit staffing changes as much as possible. Primary teachers should be with the same group of adults all day long. Floaters should be limited to as few of classrooms as possible. But we know that there's going to be a floater for a lunch break. We know that you're going to have to put somebody in when a teacher is ill or has a vacation day. We're not unrealistic about that. Just try and create as few exposures as possible. Siblings will be in their normal age group and just operate in the normal classroom as much as possible.
Okay, I think that is all the questions that we have in the chat box. So as I said, as you guys are talking throughout your communities, if you have other questions, just let me know and we will get those answers to you as quickly as we can. Let's see. Yeah, it looks like Amy, you said there are 2 more. I think that Sarah took a look at those and went ahead and discussed staffing and breaks and siblings and how that's to be dealt with in the child care groups as well. So that I think we've already discussed that. So, all right. So just a few reminders of some upcoming stuff that's happening for those of you who applied for grant funding for next fiscal year 21, the one that will start on July 1. Kind of the next steps for us is we're going to be getting the contracts from finance. We will get those out to the fiscal agents, and the fiscal agents will need to sign those off, get those back to us. Then we'll need to get the invoices from the CECC so that you guys can get those payments. So if you have any questions about that, I know that we have several new chairs And we're looking right now at doing a chair orientation where we're going to talk in more detail about that. But if you have any questions about what those next steps are going to be, just please let me know. For this current fiscal year, those budget amendments are going to be due on June 1, so that you can get those monies out. And then anybody that has unexpended funds must be returned to our office by 60 days after the close of the fiscal year, or August 29th. We do have a new intern that we're very excited to have join our team. Her name is Amanda Adkins. She's currently working, going to the University of Eastern Kentucky, EKU, working on a child and family bachelor's degree. So we're very excited to have her. She's also the childcare director at Creative Minds in Lawrenceburg, Kentucky. So we're very excited to have her. She's going to be helping me out quite a bit as we move into the next stages of this fiscal year. So you might be getting some emails from her. So please, let's just make sure we give her a warm welcome as she starts to kind of get her feet under her with the work that we do together. And just as a reminder, our next webinar will be on June 24th at 10 a.m. as always. We're not 100% sure what we're going to be talking about in that webinar, but I'm hoping that by the time we get to that date, we'll have at least a few webinars in kind of the hopper, so we'll be able to let you know what those look like. And so with that, I just want to say thank you again, Dr. Vanover, for joining us today and giving us that great information. As you guys have questions, just shoot those over to me and I will get those over to Sarah's team to get those answered for you. Really appreciate your time this morning joining us and your commitment to young children in your communities. And really look forward to working with you in the upcoming stuff as we start to look to reopen. So thank you everybody so much. We will get all the information out, that the FAQ and whatever information we can give about this webinar to you as soon as we can. Thank you guys. Have a great day.